My name is Scotty Huhn. I am a data scientist at Crisis Text Line. Excited to be here today talking with all of you. We're going to be covering a few different sections. First, I'm going to talk a little bit about what Crisis Text Line is and what we do. I'll touch on our data philosophy and some of our current data projects. At the end, I'd like to explore some of our data in a live environment together. Hopefully a real treat. So Crisis Text Line was founded in 2013 by Nancy Lublin. Before founding Crisis Text Line, Nancy was the CEO of Do Something. Do Something is the largest social change organization in the country. They have a subscriber list of millions of young people. And what they figured out is that they could use text messaging to motivate young people to get involved and engage in their communities. So Do Something would message out millions of young people about a local food bank drive, about a clothing swap. And they found incredibly high open rates, engagement, volunteerism in these communities, communicating through text messaging. Sometimes young people would respond to these text messages and Do Something had a team that would triage those messages. Usually it'd be, what time does it start? Can I bring a friend? The team would respond. People would show up at events. Sometimes messages would come in though that were out of flow, that the team didn't know how to respond to. And there was one message in particular that said, "He won't stop raping me. He told me not to tell anyone. It's my father." And the letters, "Are you there?" This message showed up, and Nancy and the team got together and didn't know what to do at first. Eventually, they sent this texter a referral to the Rape, Abuse, and Incest Network, an amazing referral, an amazing resource. Never heard back from the texter. It was at that moment that Nancy knew there needed to be a service for young people in particular to have crisis intervention and crisis support, and that needs to be communicated where texters and young people are at, and that's through text messaging. So about 2 years later, Crisis Text Line was launched. That was in 2013, and today we are a 24/7 free and anonymous crisis intervention service communicated entirely via text. Anyone can text into our service. The number is 741-741. It's sort of up the left-hand side of your keypad. And once you text in, you're connected to a real human. So our texters are connected to real crisis counselors. And those crisis counselors, the goal is we're operating in the in-fire. We're operating the in a fire or on fire stage to try to get people out of the fire. So it's from this hot moment of crisis to a cooler calm. We're not a long-term solution for therapy. We are only about these hot crisis moments. So who are our crisis counselors? They come from all walks of life, anyone 18 and older. We find about 50% of our counselors have a background in a relevant field, so in mental health, psychiatry, social work, but 50% don't. They're coming from a variety of fields, variety of demographics, ages, mothers, fathers, survivors. And in order to be a crisis counselor, it's a three-step process. Well, first I'll talk a little bit about why people volunteer. So here's 2 quotes from 2 of our volunteers. Because practicing empathy and reflective listening makes me a better friend, partner, and employee. It teaches me about believing in hope, trusting the process, and deepening compassion for myself and for others. In order to be a volunteer, we have a 3-step process. We have an application on our website, you consent to a background check, and then you go through about a 30-hour training in online training in empathy that we've pulled from both best practices in the industry, as well as iterating on that with data that we've been seeing from our platform, so that our training is data-informed on the cutting edge of real-time, how are people talking about crisis, as well as industry standards and best practices. So imagine you're a crisis counselor and you log onto our platform. It's a little bit like Facebook Messenger. So you're on a web-based platform. And on that web-based platform, conversations are incoming, and you take those conversations and begin having conversations with these texters in crisis. But you're not alone. And we think about that support in 3 different ways. The first is data products, algorithms. We have algorithms on our platform that make you as a counselor supercharged. I'm going to talk about one of those today, which is how we think about our texter triage. Second, supervisors. So we have about 40 supervisors who are on our platform 24/7, there to support our counselors through these hot moments. So they have sort of 3 primary functions. The first is supporting counselors in the moment. So as counselors need advice, maybe with a conversation on an issue that they haven't handled before, the supervisor will be there to provide that. Also quality assurance. So our supervisors are there to ensure that our counselors are following our best practices and our policies. And 3, about 1% of our conversations turn into active rescues. So the goal of our service is de-escalation. Get people from their hot moments to a cooler calm. In some cases, that won't work. And texters are still in that hot moment, and they've communicated a ideation around suicide. They have the means, they have a plan to take their life. They have the means to take their life, and they're planning on doing it in the next 24 hours. Those highest level of risk situations of imminent risk, our supervisors will contact emergency medical services and try to locate the texter and intervene to save a life. So those are the 3 main functions of supervisors on the platforms. The final group here are peers. So if you imagine this incredible community, we call them empathy superheroes, who are all on this platform taking conversations with people in very crisis, intense situations, and they're supporting each other while doing that. So you have this incredible community who are answering your questions, they're giving you supportive superlatives, they're right there with you, so that even though you are counseling in these intense situations, you know that you're not alone. So that's what we are, who we are, what we do, general philosophy from the counseling side. I now want to talk a little bit about how we're using data to save lives and what that means to us, what that actually is in practice. So here are the fast facts. We've exchanged 85 million messages since launching in 2013. That breaks down to about 2 million contacts, or we call them conversations, between a counselor and a texter. So take those 2 million conversations. Once the messages come into our system, we scrub them of all personally identifiable information and store them in our database for analysis. In addition to all of those conversations, we have millions of additional pieces of metadata that include issue tags, so the issues that occurred in a conversation, referrals that were given out in certain conversations, coping skills, all of this collected on sort of the counselor platform side. We then link that up with texter-based surveys, where we're asking our texters to report their demographics, other evaluative measures of their conversations. And you put those all together, and it's this tremendously rich set of data on mental health and crisis, one that really doesn't exist in our space. So it's really exciting for us to think about what we can do with that data set. And here are a few different shapes that it takes. So we have 2 sides here broadly. We think about data on the external side, so open data collaborations, and on our internal front, how we can make our policies and our products more efficient. So on the external side, 2 main projects I want to highlight. The first one is crisistrends.org. So any of you can go to that website right now. It's an open public-facing site where you can interact with aggregated portions of our data set. So for example, you could go to Crisis Trends right now, and you could filter all of our data based on conversations having to deal with sexual abuse. One of the pieces of content on that page would show you the percentage of conversations over time dealing with sexual abuse. You would see that there was a spike during the 2016 election, and we reached a new plateau of heightened talk. That rate began to rise in October of this year as the Me Too movement was catching steam and reached a new height just last month in October during the Kavanaugh hearings. This is our ability to put a real-time pulse on crisis trends so that as a community, we're informed on the kind of language, the kind of issues that people are talking about. Ideally, we want to put this data in the hands of policymakers, in terms of change makers, so that they can use this data to inform action. The second project I want to highlight here is our Research Fellows program. It's a new program that's been live for about 9 months now. And the main thinking here is we have this tremendous data set. And we found tremendous value from bringing researchers internally into Crisis Text Line so that they can use that data set to explore different research questions. So what that actually looks like is we ask our research fellows to be affiliated with an academic or research institution. They fly into our New York office, work out of the office for 3 to 6 months. Expenses are paid for, flights, there's a stipend too. And they get to ask really interesting questions. For example, one of our fellows who's just about finishing up is right now looking at the language that texters use to indicate positive and negative sentiment in conversations. A lot of work has been done around trying to understand how sentiment can be conveyed through text. And we have a very unique corpus to think about how that sentiment is conveyed through text messaging. So there's a lot of great research questions being asked, and we sort of accept fellows on a rolling basis. We have 1 to 2 in office at any given time. And we're really excited with where it's going and excited to see some of the findings. It's on a very different cadence than like a traditional research project. Of course, we're looking to build quickly. We're looking to publish, granted not to the same degree of rigor in like a peer-reviewed journal, but iterate quickly, working in this high-paced environment. Internally, we have a few different projects, and I'll highlight just a few of them here. I'm going to talk about texter triage a bit more in a moment. That's how we think about reaching our highest risk texters quickest. A few other projects are automatic issue tagging. So right now we ask our counselors to tag the issues that occur in conversations, but we now have a super rich data set on the one hand, raw text, and on the other, labeled outcomes of what issues occurred from those conversations. So we're able to actually now tag our conversations in real time to allow our counselors to maybe provide a better degree of care, better resources, recommended referrals. A lot of exciting projects. And the point is there's always way more things that we would like to be doing with our data set than we actually have the resources to do. But with the right foundation, we feel like that's what we've set up for ourselves, the options are really limitless. So texter triage. Back when our service first launched in 2013, we made a decision very early that our highest priority was reaching our highest needs or our highest risk texters first. So we're prioritizing severity over chronology. So the shape, imagine a conversation or imagine a message came in like this. I said, I just overdosed with lithium and I'm letting it build up in my system for a few days. The incredible opportunity that we have as a text-based service is that we can read these messages as they're coming into our system. We can assign them a riskiness or severity, and we can triage them as we wait to connect them from our sort of queuing system to an actual counselor, as opposed to a phone-based hotline, so the National Suicide Prevention Lifeline, which sort of has to service text or callers in the same order that they arrive into their system on a first-come, first-served basis. So by prioritizing severity over chronology, we reach our highest needs texters quicker. So when we launched in 2013, we started with a very intuitive model. So we took about 50 words, such as die, cut, overdose, suicide. If any of those words came up in the first few messages that texter would send us, we would flag that conversation, and we prioritize them in the queue, and we reach them on average in under 40 seconds. What you find, though, is there's actually a very nuanced language of suicide. the words that we expect to indicate suicidality are not actually the words that texters are always using to describe their feelings of pain. But this first model still did very well. We had about 53% accuracy. So as messages came in, we were able to identify 53% of active rescue conversations, so the conversations that are our highest risk. We were able to identify about half of those within the first 2 or 3 messages that a texter sent us. We knew we could do better, and we knew there were problems. What if somebody says, I don't want to die, or I don't want to kill myself, or I took a lot of ibuprofen? So we created a new model. And I want to pause for a moment here and let you all think about this. We found hundreds of words and phrases that are more commonly and more directly associated with suicidal risk than the word suicide. So does anyone have an idea of one of those words that if it shows up in a conversation, in a message from a texter, it could be 3 to 4 times more likely that we will call emergency medical services on that conversation than the word suicide? Does anyone have any ideas? Done. So feelings, hearing like feelings and lethal means. And yeah. So it's the answer is that it comes back to this sort of lethal means question. When we're answering, we're assessing suicidality again, we're looking for suicidal ideation. Does the person have a plan to take their life? Do they have the means to take their life? And do they have the intent? So there's some words that can convey all 4 of those in a single word. We actually find that the bucket of words that are most commonly associated with these high-risk situations are ibuprofen, Tylenol, common drugs that you find you can buy at the pharmacy over the counter. These drugs are 4 times more likely for us to need to call emergency medical services than the word suicide. Other words like overdose, even CVS, so going like the CVS as a pharmacy is 2 times more likely. The unhappy face emoji, so colon or semicolon, open parenthesis, close parenthesis, 2 times more likely if that shows up in an opening message than the word suicide. So hundreds of these words and phrases, and it was, I think the takeaway for us as a community is to know that the language, the diction around suicide is ever changing, 1, and 2, it's very different in text as a form of communication than the way that we might talk about it colloquially. So for this more advanced model, this is more on the maybe data details side. We actually created 3 models. Those models are sort of working together, assessing different aspects of risk, so that put all together, we now have an 86% accuracy. So we went from 53% to 86% of being able to correctly identify these highest risk conversations in the first few messages that a texter would send. So when you look at a word-by-word analysis, so imagine that this is a message that a texter sent at the bottom. Every day I put a gun to my head, but never really pulled the trigger. Our model is able to look at the context word by word. And if you see risk on the y-axis here, we actually have 3 levels of risk now. We call low risk, medium risk, high risk. So you can see that it's sort of peaking as you go to the every day I put a gun to my head, but I never really pulled the trigger. So we're able to identify that that is a risky message. So that's a sort of medium risk, but it's not as high risk as, for example, the first 70% of that message stem would be. So who are our texters? We have some incredible survey data, over, I think almost now 400,000 survey responses from these conversations. So initially, as we go back to our origin story, Nancy's idea was to found this crisis line for young people. Said young people need a place where they can find support. And largely that's what we're seeing reflected in our data. 75% of our users are under the age of 25. What was surprising to us, though, are the tail ends of both of those pictures. We're seeing two growing demographics, young and old. So young, we're seeing that now 20% of our texters are under the age of 13. If you asked us when we first started surveying 3 years ago, that was about 11%. So that demographic has nearly doubled in the last 4 years. And we're skewing older. So our sort of like over 35, when we talk about the demographics of Americans who are most likely to complete suicide, that male 36 to 40 something range, we're seeing that demographic grow in our texter population too. In terms of race and ethnicity, we over-index with Native American populations. Native American populations are about 2% of the US population. They're about 5% of our texter population. And we're about on average for Black and African American as well as Latinx texters. We also skew young and rural. So young, sort of already talked about, but rural, if you were to look at rural and poor. So if you were to look at the 10% of the zip codes with the lowest incomes, the lowest 10% of incomes across the US, those zip codes represent 20% of our volume. So a 2-to-1 over index, which is to say that texting can be a really effective medium at breaking down barriers to mental health services, mental health service adoption. And I'd like to end on these two data notes, that 60% of texters message in because they don't have anyone else to talk to, and 64% share something with a counselor they've never shared with anyone else before. So when you think about these conversations, about 40% of them are about relationships, about 30% of them are about depression, sadness, anxiety, stress, about 30% of them are about suicide. There's a huge breadth of issues here, but these are real conversations. Conversations that could be pivotal to getting a texter out of that hot moment and on the path towards more care, more prevention, and hopefully a cooler calm. So now I'm going to transition into a little live demo. We have a lot of data to work with, and we have this really cool dashboarding system. We're able to actually interact with some of the data. And I'm hoping that we can come up with some interesting questions here and then actually explore those in real time. This is a much greater level of granularity than what you can find on Crisis Trends. So I'll pause for questions for a moment. Maybe this is a good time for some Q&A. If there's anything top of mind, otherwise we can dive into some of the live demo. Looks like we have about 20 minutes left. So 15 minutes then. Yeah. Great. Yeah.
Where are the counselors physically located? Is this something that people can kind of log in, or are they in a room with supervisors and peer support?
Good question. So, yeah. What was your name?
Erin.
Hey, so Erin had a question of where our counselors are at. So it's a tremendous and unique volunteering opportunity for two reasons in particular. One, it's entirely remote. And two, it's online. So remote in terms of all our counselors, we ask them to be in a private space. So counselors are logging on in their pajamas, in bed, talking to texters on their computer, and saving lives. And to us, that's a lot of our counselors talk about how incredible it is to have a flexible volunteering schedule or opportunity like that they can also work into their own schedule. So, I started counseling as a student in college. So, I had classes during whatever hours, and I'd schedule volunteering shifts that could fit into my schedule. And now as a working adult, I can find time to schedule those volunteering shifts at night, maybe a Sunday night or something. So both being remote as well as flexible to our counselors' schedules make it a really powerful opportunity to have the kind of impact that a lot of our counselors are searching for. Yeah.
have another question about counselors. Do you have any kind of like continuing self-care? Maybe interested because of personal experience. It's a lot of process.
We put a huge emphasis on both self-care as well as vicarious trauma. We think about vicarious trauma as both an idea that we have to be aware of for our counselors as well as our staff. Of course, our staff working in this material all day can be really triggering as well, given our own lived experiences and our own what we're bringing to work each day. So we have a bunch of different ways that we think about it as an organization. On the counseling side, all of our counselors have coaches. So these are people on staff. We are helping them through training and answering any of their questions, potentially helping them through triggering moments. And then in the moment on the platform, the supervisors are there to debrief after difficult conversations. We make sort of debrief moments really explicit and calling out that it's a critical part of your own self-care and your ability to support texters to think about your own self-care. Nancy says all the time that you can't pour from an empty cup. We really try to make that a philosophy we use both from the counseling side as well as on staff. Yeah?
I have two questions. One is related to the business model and one about the medium with text messaging. So for the business model, of course, they are all volunteers, but I assume you as a data scientist get paid.
Mm-hmm.
So what is like the business model? Who is funding like those people who are actual employees? And the second thing would be about text messaging. When you think about fidelity and relationship, you can also think that a phone call would be more personal. Nowadays, people do like even face-to-face computer calls and stuff. Of course, you want to protect the anonymity of your counselors, but how did you came up with text messaging as a medium? Is that safer when compared to phone calls and easier, of course, for the data analytics? Or what are the reasons behind that decision?
Okay, so the first question, I'll answer the second question first. The second question is around the medium of text messaging. Why did we choose text messaging? The main answer there is Nancy saw a gap in the existing service delivery models for mental health services, that there was no service delivery model that was meeting young people where they were at, and where they were at was text messaging. So we find the users that are self-selecting into our service are those who might not be comfortable ever picking up the phone. They might not be able to verbalize what they're feeling inside, but they'd feel comfortable texting it. We find that every day we spike during lunchtime. We spike in volume during lunchtime. When people are at school, maybe they're surrounded by a group of friends, but they find safety, they find private communication through text messaging. So a question we get a lot is, so why don't you offer a phone line too? Or what if they want to talk on the phone? Will you call them? We don't. And the decision there is very explicit that our specialization, what we're good at, are these hot to cool moments through text messaging. If a texter wanted support through a phone call, for example, we would refer them to the National Suicide Prevention Lifeline, an amazing organization doing great work, who's ready to support them in that mode of communication. And remind me the first question again?
Business model.
The business model, okay. Business model, a question we also get a lot. This is very expensive. This is very expensive work. It's always free to the texter. The texter will never pay, which is really important to reducing those barriers to access, barriers to care. So far, Nancy has sort of pioneered this venture capital model for nonprofits, which is kind of unheard of. So she's raised fundraising rounds that are all impact funds through different venture capitalists and then investors. Right now, right now it's primarily a donation-based fundraising. In the next few years, there's different ways that we can move towards sustainability. I can talk briefly. So briefly, we think about sort of three different ways. One, we actually have a for-profit entity that is wholly owned by Crisis Text Line. It's called Loris.ai. And what we're doing with Loris is we're taking our training model So training people to have difficult conversations, and we're applying that model to the business world. So we're actually using this Loris AI is using our model for companies in teaching their customer service reps, for example, how do you talk to a customer to get them from their pain point towards resolution while providing empathy or providing understanding. So if Loris does well, Crisis Text Line will do well. Another venture using some of our data products, so even some of our triage tools to be really effective with some networks, for example, Facebook, and understanding the severity of different users on their platform and taking learnings from our data products. And finally, at some point, we think we're going to be so ingrained in the mental health space that governments will have no choice but to fund us as sort of an obligation. We're like too big to fail in the mental health space. We wanted to steer clear of that in the early years because government funding can be, of course, really hot and cold. And we didn't want to determine the success and the viability of Crisis Text Line on grants that we may or may not receive. But at some point, as our exposure grows even more, we think that's going to change. That's how we think about our business model. And we think we're about to close a fundraising round right now in the next few months. We think that's going to be our last fundraising round, so that the next 2-3 years we're financially sustainable. You had one question, and then we'll hop to some data. Yeah.
I was wondering what kind of data you collect, depending on kind of whether or not people are following up on your referrals, and if you have like repeat customers, like.
So to referrals, yes. We like all the referrals we send out. We use Bitly links. So it's just some very basic like user tracking of like do texters actually click through on the referrals? About 70% do. So referrals only happen in 20% of conversations. They're always opt-in referrals. So we get to an end of the conversation, and let's say the texter, is dealing with severe depression. And if somebody is dealing with severe depression at the beginning of the conversation, they're most likely going to still be dealing with severe depression at the end of the conversation. Maybe they'll have a different perspective on it or feel a bit cooler. But at that point, it'd be a good opportunity for a counselor to ask a texter if they'd like to see an additional referral. And we have a whole list of vetted referrals that are free, non-judgmental, 24/7 as well. In those cases, a counselor will ask a texter, would you be open to checking out this so-and-so webpage? They say yes, we send them a referral. About 70% of texters click through to that link. So we see a pretty high adoption there. And yeah, there was another question too. Repeat customers. So we track all of our texters, or we have some basic user tracking on their phone number.
Yeah.
So it's pretty easy for us to look at sort of like repeat customers. Yeah. We see about, on average, texters are having between like 2 and 3 conversations with us over like a 2-month period. We find that's like a standard crisis. It's like you're messaging them like 2 or 3 times. On any given day, about 60% of our texters are new. About 40% are returning. They're returning for a second, third conversation. And there's some really interesting trends there around what that returning use looks like, which we probably don't have time to talk about today. But some people, of course, will default towards the like super user category, where we'll be becoming a substitute for like, therapy and counseling in a way that our system isn't built for, and that's not who we are. So we have different techniques for sort of that far end as well. But the standard use is like 2 or 3 conversations across about 2 months. One question, then we'll go.
Yeah, so you have a really rich data set through this, and it's a fair amount of engineering from charities and who's using this product. But how is that informing your strategy around reaching out to those communities or anything that's happening with that?
Definitely. So we use our data to inform who we're targeting. So of course we have a limited ability to grow our service into outreach. We also have a really challenging problem, which is that we don't actually want we don't want a lot of repeat customers, for example. Our goal is to help you through your crisis in 1 to 2 conversations, and then hopefully you don't need us for maybe several months or maybe several years, which presents a really interesting challenge. Google gives us like ad grants, and so we use some advertising, all that's been like donated from Google. And so we'll use those funds to target particularly like marginalized or groups that we know from our data are experiencing crisis very severely. For example, this under 13 population that we can look at in a moment, they talk about self-harm at 2 times the rate of our general population. About 20% of their conversations deal with self-harm. So in those Google ad grants, we target some of our like toolkits and like automated or sponsored posts to that group. Because we know that is a group that is experiencing a very intense crisis and might not have any other support, and also find a lot of benefit in our service. They give us some of our highest satisfaction ratings, for example. They're really satisfied with like with the outcomes of the service. So making sure that ideally you have a virtuous loop, right? The data is telling you something about populations, you're feeding that back into the way that you're targeting those populations so that everyone's benefiting, everyone's learning. The same is true in training. We want to be learning things from how our counselors are counseling, feeding that back into training so that new counselors are learning best practices. And I think the tighter we can keep those loops as an organization, as a community too, is when we're a lot more effective. So let me try to switch to